Big warm welcome to everyone on the panel. Dr. Raina, we'll begin with you. We've heard all the hard, startling facts. Breast cancer cases are on the rise in India. And yet we see so many late stage diagnoses. I mean, as compared to the US and Europe. What are the reasons behind this? What are the barriers when it comes to early detection?
Good afternoon. First of all, are you asking me the causes of rise in the breast cancer, or are you asking?
No, why are they such late stage diagnosis?
Stage diagnosis is basically lack of awareness in the general population. You know, there are so many campaigns in the Western countries to make people aware of breast cancer, like the one we're having, but it's a bit 30 years late. These campaigns in the Western countries started nearly 30, 40 years ago. And that is how the screening program started. In the Western countries, because of screening, the breast cancer is detected at a very early stage. Stage 1, very early stage. We don't have a national screening program here in India. We have what is called as personal screening or private screening, where women who are aware of the breast cancer diagnosis, they go personally to their physicians and get themselves mammogrammed or get themselves examined. Second is the lack of awareness, the educational awareness. I think the government has woken up in the last 10 years. They're increasing awareness programs. So if the patient, a lady feels a lump in the breast, I think she's very shy. She doesn't reveal it even to the family. I've got many patients who don't even tell their husbands or their children that they have a lump because they feel shy and they don't want to. Second is that they are not sure what it is. Sometimes people tell them that it's tuberculosis. So they ignore it for a long period of time, maybe 6 months, maybe 1 year. So from stage 1, it comes stage 3 or stage 4. And third, of course, is that the facilities are not in rural areas, are not available nearby. So if there's a lady in a rural area who has a breast lump, she may have to walk long distances or, travel long distances to see a doctor. It's multifactorial why the breast cancer presents in late stages.
In your opinion, what can we do to, improve that public awareness?
Do programs like this every day instead of, once in a year. Honestly, you have to increase the awareness, at a national footing. You see, the peak of the breast cancer is it starts rising after the age of 45. So you don't have to target young women. I do see young women here who may have been diagnosed as breast cancer, but that's very uncommon. The commonest age for breast cancer development is after the age of 45, 50. That is why the screening programs in the Western countries are targeting women above 45 or 50 years. So don't get me wrong. I am not recommending screening for young women. It's not been proven to be successful. Even for older women, there is some controversy as how far the screening programs have helped to reduce the mortality. What is the aim of screening? Aim of screening is to reduce the mortality. You pick up the breast cancer early and treat it early so that the outcomes are better. So with the screening programs, with mammography programs, stage 1 breast cancer has been picked up in large numbers in Western countries. But since the detection was picked up in early stages, they have not resulted in reduction in mortality. That's why the breast cancer screening programs have suffered. With stage 1 breast cancer, women can live up to 10, 15, 20 years also. So we may have to follow up these patients for another 10 to 15 years to show that the screening has reduced the mortality. But most important is the awareness, self-examination, as you mentioned, and screening comes number 3. And screening, there's no national consensus in India. General consensus in the Western world is 45 to 50 years. You should start screening. And you should start screening those patients earlier if they have strong family history of breast cancer.
And how do we prevent that shyness? When women have felt something of a lump.
I think India is transforming. The shyness is going away. In the last 20 years, there is I think women are being liberated. They are coming to the forefront. They are being employed. You can see that more and more women are educated. It will come. It will come. You'll see in the next 10 to 15 years, the whole scenario will change. It's happening. But the information or the awakening should go to the rural areas, far-flung areas of India, which I think is happening now through TV and other channels. I think it's happening. Revolution is taking place.
Small steps. Many more events like this. Mr. Patel, Dr. Patel, are you hearing? Should do it not just once a year, but many times a year, maybe. Dr. Vijay, my question to you is a patient has been diagnosed with breast cancer. Um, you know, they're very overwhelmed. What advice do you give a patient when it comes to when they've just got a diagnosis as to how they can prepare themselves, emotionally, physically, mentally for the very, difficult road ahead?
I think that's a lovely question in the sense that when patients come with us, they come with different backgrounds. So, at one point of time, you are wanting to give them all the facts, and sometimes they could be really hard facts regarding the stage of the disease, outcomes, treatments, and everything. At the same time, you also want to create a sense of hope in them because you want, like all the previous speakers said, you really want to tell them that at the end of the day, we are going to at least treat you, and in many cases, especially like Dr. Raina said, stage 1, stage 2, it's also going to be curable. Even in stage 3, there are very high chances of cure. So it's a tightrope walk between trying to give them, that hope, that glimmer of hope, and at the same time trying to, give them the hard facts. But the family and the patient must be made aware that it's a long treatment, very hard choices. They may require multiple treatments over the next several years. And but what has happened in many of the urban areas is that we have very good counselors, and breast cancer support groups have started to evolve. So at my own hospital, we have a lot of counselors who counsel patients. It could be not only emotional, physical counseling, but even sometimes financial counseling, because a lot of our patients can't afford. It's only initiatives like this which make treatment accessible to patients. So emotional hand holding is also required. At the same time, different patients will have different needs. So we need to be like Miss Divya here, she has been part of our breast cancer support group. So when one patient tells another patient that, I have been treated for this, or I have undergone reconstruction, undergone breast conservation surgery, radiation, chemo, that conversation between one woman and another is probably inspires the greatest confidence in her that what the doctor, many of us on stage here, are saying will come true because this happened to someone maybe 2 decades ago.
Also, we're going to be unveiling a very beautiful book called Stories of Hope. How important are stories like this? How important we really need to make this book reach many, many, many people, because how important are stories of hope like this, which a lot of the women over here have shared.
So many of my own winners have featured in this book, and some of them are on stage and in the audience. But there has always been an air of despondency and hopelessness because, like Dr. Raina said, for many years in India, majority of the patients used to be in stage 3, stage 4, where the outcomes used to be very poor and dismal. From that, there has been, I would call it a stage migration, where we see a lot of patients, at least in the urban areas, in stage 1 and stage 2, where outcomes are much better. So this message will take a long time to percolate, create awareness, and for them to realize that many breast cancer patients, there are a lot of myths about breast cancer. So a lot of these myths will be dispelled by these books. They will feel more confident of undergoing the treatment, surgery. Not all patients require mastectomy. Women are ultimately afraid of physical deformity. So not all patients require mastectomy. Many may not require some may not require chemotherapy, and many of them live a very fruitful and
Fulfilling life.
complete life.
Thank you, Doctor. Moving to you, Dr. Walia. It's the easiest exam, as the campaign says. It's 3 minutes every month. And yet we can't get women to take out those 3 minutes or give themselves those important 3 minutes. What is it that we need to do to inspire women to take that self breast examination?
Very apt question, I say. And before we really start thinking of that, yes, we should be telling everybody, we should be creating more awareness, and everybody needs to, every woman needs to just devote just 3 minutes. It means 3 minutes every month. We need to deep dive and understand the reason that why, even in spite of it being so simple, effective, cost effective, hardly takes any time, why we are not able to, in spite of so many oncologists and then the way India is progressing, we are not able to achieve it so far. So again, going back to your first question, I mean, what you rightly said, why it doesn't happen is the first and the most important point is awareness which is lacking, and it is sadly lacking not only in the rural parts of our country but
Also
also in the
urban
urban
areas,
areas.
yes.
I mean, even I mean, like I belong to Delhi and basically Delhi NCR, and we find day in and day out people coming from the heart of the capital of the country also not aware. Second thing is like being a woman, I think you can also understand. We Indian women take pride in family first attitude. And so whatever it is, we take pride, we feel we really like that, like it that way, and the whole family is like that family first attitude. Everything is important, whether it is the exam, kids exam, or their even simple tournament, or their tuition classes, or a marriage in the family, or simple functions in the family, rather than our own health. Probably, I mean, it can be anything. It is that we sincerely, we believe, we have been trained, we have been brought up that day. And we also need to, somewhere down the line, we also need to understand is that it's not being, don't have to feel guilty when we start giving some importance to ourselves also, or some importance to our health also. After all, looking after your own health is something which is very important for your family.
It's a priority because you can't pour from an empty cup.
Yeah,
Yes.
exactly. So many times I have to, you do find like something like our patients coming and they have been detected, and then we are counseling to start treatment. And at that time also you find people like kind of trying to defer treatment. My son's exams are there, or this is there. Can I postpone the treatment by 15 days or
So
so?
after, sorry, let me get this straight.
Even
After
after being-
knowing that they've
Yes. Yes,
got
it-
breast cancer,
Yeah.
they will postpone the treatment because of something in the family.
Yes, and I can vouch that each of us, all the oncologists on the stage, can be a witness to that many times. I mean, diagnosed, and then when we are insisting that treatment has to be started, and at that time also there are incidences where people keep on postponing the treatment. Very easily. So this is something I think has to percolate deep down. Is that, and the first thing I always tell my patients also is that if you are going to be there, only then you are going to be there to actually look after your family for a longer time, and that is what is more important. So all these things like awareness is the first thing. They need to be aware that they need to do a simple test and how it is going to help them, and that is where the role of all these tests, like easy test, easiest exam, what we say is, and that percolation comes, and then they are doing it not only for themselves, they are doing it for their family, they are doing for their own loved ones, and plus somewhere we need to fight the social, as Dr. Raina very aptly put, the social stigma associated with it. There's nothing wrong being aware of your own body, doing these simple things, and if you find something, approaching the doctor or approaching your healthcare provider. And here is where all our responsibility lies, of everybody. I say people from the media, people like you, and we all oncologists also, everybody who is aware of the gravity of the situation. Each one of us has a onus. We need to give it back to the society, to spread awareness to each and every woman, to to the society on the whole, that these are simple things and it really matters, and it can be a game changer, and it will be a game changer.
Well, a beautiful campaign, a very effective campaign, a hard-hitting campaign like the easiest exam. It is the easiest exam, a public awareness campaign that's got so many views. What kind of impact do you think that'll have? How much will it convert to actually people doing the deed, in your opinion?
Well, if we look at, the figures were 90 million views. Huh? Yeah. So that is really a huge figure. But do we really feel that all of them is going to be really converted into action? Then I don't think so. You know? But every drop in the ocean counts. So somewhere we have begun. In the long run, it will definitely count. And again, when we are talking of awareness, we need not only make the women of our society aware, we need to make the men of our society also aware that these simple things are available. And then it is like, if the suppose the son asks the mother, whether she is just checks on her whether she is regularly doing her self examination, I think it will go a very long way. So all these things will definitely make a matter, not overnight, but definitely the change has begun, and that is what is important.
First steps are important. Dr. Goyle, let's talk about caregivers, the importance of support from your family. What kind of advice do you give to caregivers? Because it's a very difficult journey for them as well. It's a very overwhelming journey for caregivers in terms of the fact that someone close to them has been diagnosed, and they require a lot of energy, attention, emotion. So what advice do you give to caregivers and family members to play a more supportive and positive role in this journey of
I think this is a
healing?
very important question which is often neglected. Our focus is so much on the patient all the time that we forget to realize the importance of the caregiver in this entire situation. I always believe that cancer doesn't affect a single individual, it affects the entire family. And that's where the caregiver also suffers equally during the entire process as a patient as well. From the caregiver's point of view, I think they are so much involved in the patient's journey, in taking care of the patient's health, appointments, bringing them to the hospital, giving them medicines on time, looking after, but more importantly, their emotional health as well. It's very important to support them emotionally at that point of time. But that's where I think sometimes there is lack, and that's where relationships do fail at some point of time, that. But it's equally important for the caregiver also to look after himself or herself. Because if you don't look after yourself, how will you look after the patient? So somewhere down the line, the caregiver also has to look after his or her own needs and make sure that he or she is well enough to look after the patient. I think that is very important as well.
What advice do you give caregivers? Because you have people come with the patients. What do you tell them? That you do counsel them separately? Is there something that you...
No, normally they come together. We tell them that, you have to just emotionally be there. Sometimes there's a blame game. If suppose somebody has a disease, an illness, the caregivers are not able to accept it very easily. So that's why we counsel them that, yes, give us some time for the patient and yourself to accept the situation. It's not easy for the patient. It's not easy for you as well. You have to have empathy with both of them rather than just the patient alone, because the caregiver also needs empathy as well. And that's why we've got counseling sessions for the caregivers as well. We have a cancer patient support groups where we call both the patient as well as the caregiver. And we ask both of them to speak on stage and share their experiences. And you find certain very, difficult situations, different answers come forward. So it's not an easy situation for the caregiver as well. But, that's how life is.
Thank you, Doctor. Dr. Dattatreya, let's talk about lifestyle choices and prevention. Now, I was watching the video that was playing a little while before the event started. I didn't know that, obesity could be a cause or, contributing factor to breast cancer. So, talk to us about lifestyle choices and how we can change our lifestyle, modify our lifestyle, lead a healthier lifestyle, have healthier habits, so that these are factors that will contribute to prevention.
I think aptly brought out by you, whether we like it or not, by and large, majority of the cancers or overall cancer can be labeled as a lifestyle disease. Now, if you want the future to be different from the present, study the past. The man who has no sense of history is like a person who has no eyes or ears. If you don't know history, then you don't know you are a leaf belonging to that particular tree. There's this person by name Siddhartha Mukherjee who writes this book by name The Emperor of All Maladies. Of course, that's cancer. And he talks about the journey of how Zydus spoke about his journey of conquering the disease from chemotherapeutic agents to targeted therapies to pills in the videos we saw before. So, like that, I think in a very simple language, he discusses how the journey or the crusade to cancel cancer over the past many decades or centuries unfolded. And in a very simple language, even a BSc graduate can understand. So that's very important for us to know. And then there's this man by name Dan Fagin who writes this book by name Tom's River. Now, Tom's River, of course, is the name of a river in the US. It's also the place, and therefore it's a Tom's River Township. It's a story of science and salvation. And the foreword to this book is given by Siddhartha Mukherjee. And what does he say? Dan Fagin handles topics of great complexity with the dexterity of a scholar, the honesty of a journalist, and the dramatic skill of a novelist. I'm sure Mandira Bedi also must have been part of some of the toothpaste in our childhood. We had Binaka and Sibaka toothpaste. So the Siba Kaigi chemical company used to make this Binaka and Sibaka toothpaste. And the same company also prepares the aniline dyes which color our clothes. The Toms River Township was there in the US near New Jersey. And above that, above the township, you had the Siba Geigy chemical company producing these aniline dyes. Aniline per se does not harm us, but the byproducts are extremely toxic, both liquid and gaseous, and constantly causing air pollution, water pollution, and land pollution of the Toms River Township. So much so, it became a cancer cluster. And oncologists like all of us working in the US, in the Atlantic City, in New York, Philadelphia, found more and more patients of cancer coming only from the Toms River Township. For almost 30 years, this continued. Salvation happened only when the Siba Geigy chemical company was permanently shut down. And that's not an easy job at all. We have not yet been able to shut down the tobacco industry. So now the incidence of cancer in Toms River is the same as anywhere else in the US. Tobacco smoking causes lung cancer. Tobacco chewing causes head and neck cancer. But do we know the cause of breast cancer? If you could know the cause, then we could possibly nail it. Cervical cancer is caused by human papilloma virus. We talk about cervical cancer Mukt Bharat by 2030 or 2035 because of the cervical cancer vaccine. But we do know that breast cancer, there are some risk factors. Say, for instance, early menarche, which means before the age of 9 or 12 years, the first period start happening. Late menopause after 55 years of age. Obesity, alcohol, tobacco, high body mass index, not getting pregnant at all, or first pregnancy after 30 years of age, not breastfeeding, using some hormone replacement therapies, or some OC pills will contain more estrogen or more progesterone, etc. So all of these risk factors, some we can change and some we cannot change. What we can change is to adopt a healthy lifestyle, saying no to tobacco, saying no to alcohol, making sure that for the height, we have a healthy weight. All of this will go a long way in making sure we are able to prevent breast cancer. Now, you can't change your personal history. If you already had breast cancer in the past, then there's a chance of getting on the opposite of breast cancer when compared to others, much more. If your mother had a BRCA mutation, like Angelina's mother had a BRCA mutation, and you again got it from her, you can't change that. So risk factors, some you can change and some you can. What you can change is your life. So therefore, a healthy, hygienic, balanced diet and a healthy lifestyle will go a long way in preventing breast cancer. And that's why I liked the stories of hope also by Patel sir and everybody else who are part of this journey, because the diagnosis of cancer sends a shiver down the spine of even the strongest of human beings. And hope is the only thing stronger than fear. Thank you so much.
Beautiful. Thank you, Doctor. Divya, coming to you. Strong
Mandira.
woman. You got diagnosed at the age of 34.
Yes.
You had a small toddler, 1.5 years old. I can't even imagine how overwhelming it must have been for you, how difficult it was. But here you are standing on stage on the other side of it. Kudos to you. Big congratulations to you.
And thanks to my doctors.
Of course, nothing
my
without the
family.
doctors. I bow down to doctors. But I want to ask you, and I think everybody over here would like to hear, what it is that kept you going, what kept you resilient, how did you cope?
So, Mandira, for everybody asks this question that, or people call you brave because everybody is short of words when they hear something like this. But it is very important to understand resilience is not a straight line curve. Like every emotion, every thing we deal with in life, it's ups and downs. So, as far as you are able to stay on the positive side of it for most of the time, you got it in your control. Cancer for me is can certainly overcome, which is
1 second. Round of applause. I love that line. I've never heard anybody say that. And I've been, for many events like this, but can certainly overcome. We like that.
because my doctor, when I visited him the first time, told me breast cancer is curable. And also for all the breast cancer patients, they get a what I called a processing window. Now, this processing window is the time between your mammogram biopsy and the time the results come. Typically, it is the 1 week processing window. The sooner you process it, the easier it gets for you. So, when you say about how can you be resilient, there is a very simple 4-step method which I think helped me. I have named it for easy to for everybody. It will be easy to remember saying the 2 p.m. method. Now, when you know that you are being diagnosed with cancer, figure out your purpose. You are scared of losing your life, means there is something you want to see out through in your life. For me, it was raising my daughter, seeing her milestones. So that for me was the definition of my purpose. So that processing window gave me that clarity on why am I scared of this result turning out positive, and what can max happen if it turns out positive or negative or whatever. So my daughter is my purpose. Now manifest that purpose into your life. I'm here. I'm going to see her graduation, marriage, everything. So I manifested that purpose. I manifested life after cancer. Then live your passion. I love my work. And doctor knows I work throughout my chemotherapy, my surgery. There are ups and downs. I also had a accident or a where I was bedridden for 2 or 3 months, and every patient goes through tough times. But apart from that, I was thankful for my to my managers and an organization that supported me throughout. But my work kept me going, so that was my passion. And the last and the most important thing, which is people feel is very overrated, but I think it's the most important of them all, is meditation. It gives you the processing time. So I was meditating 10 years before, from 10 years before I got diagnosed with cancer. And every single day since my diagnosis, I've meditated for 1 hour at least. So that for me is the time when you are able to process it, download, assimilate the information, react to it. So this two P's and two M's keep you going.
That's beautiful. Big round of applause. It's wonderful how you structured it and put it all together. As a follow-up, I'd like to ask you what words of advice would you give to somebody who, I'm sure we're recording this and it will reach the right places. What words of advice would you give to somebody who is currently battling with breast cancer? Just, because this would be more inspiring than anything else.
So I believe in an equation. I'm an engineer, so it all comes to processes and
You're a very cool lady. That's all I know.
so E plus R equal to O. So the event in your life, E is the event. Here the event we are talking about is diagnosis as a breast cancer patient. The reaction to that event is what determines your outcome. There are two things that need to be taken care of in your reaction. First is the acceptance. Because the sooner you accept, the faster you get things going, and the action steps are faster. Like I remember 2 days into my diagnosis is when my chemo port surgery got scheduled on Women's Day, 8th March. So that is how things move faster because of the doctors and the team you have, because you have accepted and you are asking them what are the next action steps. You are asking that question to the right people. The second reaction that you need is the determination. As I said, can certainly overcome. You need to have that determination to see this through. And when you have that determination, you have the biggest ally by your side. That is your mental strength, your mind. And body is a weak cousin of the mind for me. I think that if your mind is in your control, then everything else will follow through. But once you lose control of your mind, then everything else will start falling off. So, if you have once you hear about this diagnosis, please accept it. Please approach the right team, the right doctors to take it through because they know it better than you. And then please have the determination that you will see this through. You know your passion, you know your purpose. Let discover it, define your life through it. And if you know that you want to see this event in your life, you will certainly be able to see it.
I have to tell you, Divya, you're made of something else. You're a very strong lady. And when you speak of acceptance and you speak of that determination to see things through, a lot of patients, when they get the diagnosis, and I'm opening it to all the doctors here, when they get that diagnosis, the acceptance takes a very long time. A lot of them go through this feeling of why me? Why has this happened to me? Life is so unfair and all the rest of it. So how do you see a patient through? Because until you get to the stage of determination, if you don't have that mental strength, that's the battle lost, right? So how do you get patients to overcome that why me? Why is this happening to me? Because until you cross that bridge, you can't heal. Anyone would like to?
I wanted to highlight, from this discussion that has been taking place. One is that has not been said enough is breast cancer is a disease of aging. So the commonest risk factor or biggest risk factor is the aging. Aging you cannot stop. It's not, if you're looking for causes of breast cancer, you won't find, in 90% cases, you won't find any cause except the aging. It's a disease of the elderly women.
But
As
here
you
we
see-
have a young
No, no,
woman
that
at the
is
age
an
of
exception.
34.
It's an exception, madam. It's
Okay.
an exception. Most of the breast cancer patients are above the age of 50, 55. And it peaks at the age of 75. Highest incidence of breast cancer in a woman in a population is at that age of 75. Number 2 point. Can you prevent breast cancer? You cannot prevent breast cancer. You can diagnose it early so that the outcomes are better. So talking of prevention of breast cancer is not possible. It will happen in many women as they age. Our aim of this talk, this discussion today, and other programs that are directed at women are at picking up breast cancer at an early stage, not for prevention. We never call prevention of breast cancer program. There's no such term. Third is we were discussing how to target and whom to target this, breast self-examination. I think the target should be women above 45 years. If you target it at women 25, 30, it will lose steam because you won't get any result. You're targeting the wrong women. So it should be, and a lot of effort will be wasted. If women start at the age of 25, 30, they start examining, they won't do nothing. Unless you're 40, 45 years, the yield
But doctor, there are many cases.
examination increases as the age is higher. And
I know of at least 3 women in their 30s who've got. There are many exceptions, and if there are that many exceptions, there should be
10% of breast cancers occur below the age of 35 years. The 90% occur above 35.
YMA syndrome, as we all know, happens with all the cancer patients. And invariably, the first question is why me? And yes, the next step is the earlier, as she very rightly pointed out, the earlier she accepts, she's ready to take the treatment. And how do we as oncologists tackle it? So there is no other way than a counseling, a proper counseling for a lady, not only for the lady, but also for the family to come out of this YME syndrome. And some hospitals, some onco centers have trained onco psychologists who are doing that job wonderfully well. We at Sir also talked about his own center, and we at Max also. We in our department we have a full-time onco psychologist who is trained in this specific field and is dedicated for this thing only. So the every patient of ours, their first or second meeting after the diagnosis, not only the patient, the family also, they get this session done. And these are the sessions, what I feel is there is no other answer. The sessions with the psychologist, or even many times they are treating oncologists, the oncologist they are seeking, they also devote your first or second meetings are very, very meaningful. Apart from just discussing the overall treatment plan, the major part is spent in managing this YME syndrome because you can only discuss the treatment plan once this thing is over.
I think, this why me? Listen, it takes time. You have to give time to the patient and the family to accept
not
these things.
everybody's like this
Yeah,
lady here.
exactly. Not everybody is equal mentally strong or physically strong. So you just need to give time. And that's where the family plays a role. Your relatives, your friends, they play a role in making you accept that things are there. Obviously, as if you're a strong person, you will accept it sooner. I will get on. But time is the best healer, and sometimes they don't accept in the first few days. It takes time. They may accept in the first month. During the treatment, they may accept and then come to terms with the situation. And then, the progress starts.
Doctor, you'd like to say something?
So, what this basically breast self exam tends to create is breast awareness. What the campaign wants is that women should be aware of their own
Bodies.
breasts and look for changes. So, it is not that age is any cutoff at any point of time. So, younger women can also perform the self exam, but they need to be aware and look for the changes that are listed out. So, as Dr. Raina pointed out, as age increases, the chances of developing malignancy are higher. In younger women, the chances that you are going to have benign lesions are higher. And but you need to be aware of the changes occurring in your own breast by doing the breast self exam, is what this campaign tries to send out that message.
Thank you, Doctor. Mr. Desai, I'm going to come to you. Zydus is a leader in the oncology space. So, what role is your company playing in supporting breast cancer prevention and improving access to treatment for patients across India?
So I guess the issue of prevention has already been settled by Dr. Raina, so I'd rather not go there. But yes, in terms of early diagnosis, um, treatment, better treatment options, and support, there's certainly a lot that can be done, that is being done. You know, when it comes to tackling any health-related issue, traditionally we've always looked at three factors, three pillars on which most solutions rest: awareness, access, and affordability. Now, these are the three pillars which have traditionally always been spoken of when delivering good quality care. But this is the time of AI, so I add three more I's to this. And I guess as far as cancers are concerned, these three are very, very important. First is innovation. Second is inclusiveness. And third is initiative. Often people think access and affordability are interchangeable. If you make something cheaper, it'll become more accessible. That's not true. Many a times, even affordable options are not available to patients simply because of access issues or awareness issues. Simply reducing costs don't help. You have to raise awareness. You have to make sure that there is better delivery of care. It is available where it matters. Like Sir spoke of a woman in a rural area, if she has no access to a physician, even if they've conducted the self breast exam, even if there are treatment options available, and believe me, there are about 22 schemes that the government runs today, specifically for cancer care. But half the population wouldn't be aware of it. They would be able to afford many more medicines simply by enrolling through one of those schemes. So awareness is extremely important. For the other three, innovation, inclusiveness, and initiative that I'm speaking. Initiative we just spoke of. Easiest exam is one such initiative. And awareness is not limited just to, like what very rightly said, to women alone. Unless the whole ecosystem is aware, no disease can be defeated. So you need to have a systematic approach, and such initiatives is what at Zydus we've been trying to take. Having diagnosed, it's not always necessary that one would benefit from particular treatments. So there are prognostication tools available. There are diagnostics that are available. And making sure that the right prognostication tools are available to determine whether the patient benefit from a particular treatment, to have the right diagnostic treatment so that targeted treatments can be given. And we are working as an organization in making all of this. And that's where innovation and inclusiveness come in. MD spoke of Anaya Care. Now that's today technology enables us actually help the patient navigate the entire journey. So when you have a digital ecosystem that helps the patient right from diagnosis to post-treatment care. Now, oncopsychology is something that Madam spoke of, Mrs. Walia, of oncopsychologist. As a discipline, everyone would agree with me that it's an extremely important part of the whole journey for the patient. But those services are not really available everywhere today. To any patient who enrolls on the platform. So they don't physically have to have that access. So it's not just making treatments available, affordable. Innovation helps us bring better products, innovation helps us make them more cost effective, more within the reach of patients. But it also helps us in improving delivery. And ultimately, I think all of us play different roles in the ecosystem. But if our entire focus is on outcomes for the patient, see, if the industry only worried about treatment options, if the doctors only worried about treating a patient, if somebody who had to, another agency had to work about affordability, ultimately the center of the universe has to be the patient and her health outcome. So when we include all of this, bring them together in a seamless fashion and help a patient and the caregiver navigate through that journey, we make it possible for them to derive the best possible outcome that they can get. Naturally, all outcomes are never going to be possible. But the best possible outcomes can be guaranteed if we have inclusive systems. So at Zydus, our effort has really been focused on, there's this very cliched term that we as an industry have always been accused of using, which is called patient centricity. But then ultimately that patient centricity has to result in better outcomes for the patient. If we think of patient centricity from caregiver's perspective, it doesn't. It has to be thought of with the patient in the center of the universe and ensuring the best outcomes for her. And our effort for the last few years has really been focused on that. So while what gets most visible is our products, because that's how we reach the medical fraternity and the patient. But there's an ecosystem that's getting built around. And such initiatives actually help guide people towards some of those options. Ultimately, not everyone is going to adopt every option that is available. The idea is to make it available to them, make it accessible to them, and with the digital revolution that is taking place, it is possible for all of us to work towards improving outcomes for patients. So long as we are outcomes focused, our thinking would not be limited to any one particular aspect of the world. And that's where I think we've been working at, and we've gotten tremendous encouragement and support from the medical fraternity as also from patients. See, 90 million is not something that happens without it becoming an organic movement. So obviously there are people, and it would be, I would be misplaced completely if I would think that all 90 million are women who have seen it. Naturally, there are probably going to be more men who have seen this. And I hope that helps them, develop that sensitivity and kind of make their family members or their friends and those in their social circles aware that something as simple as a self-breast examination, a 3-minute examination once a month, can actually help them detect the disease early, go to the doctor, seek the right treatment. And that's where then all of us can play a role. And we keep getting inspired by such amazing stories, because it's not always that you get to hear that a person within a couple of days of being diagnosed, and I'm sure all my oncologist friends here would agree, it's a rarity to find someone who would go on the second day and say, okay, fine, what are the next steps? Not many people do, but we hope that such stories, the stories of hope that we're talking of, would inspire more and more people to take
You
that
said the
step.
magic words, Mr. Desai. It's time
Thank you.
for stories of hope. Thank you. A big thank you to all the panelists. Using Divya's language. So the 2 I's, the insights and of course the inspiration.